Good afternoon, everyone. Thank you all for joining us today for the Hospice Quality Reporting Program Provider Training. My name is Gwenda Davis, and I will be your host and moderator today. Before we get started, I will review a few housekeeping items. This webinar is being recorded. It will later be posted to CMS's Hospice QRP website. We will provide you with details on accessing the recording via email when it is available. If you would like to enable or disable the closed captioning function, please click on the Settings button near the top of your screen to enable or disable the closed captioning. The Settings button is a gray gear icon, and you can use that to enable or disable the closed captioning. If you would like to download today's presentation slide deck, click the folder icon located on the bottom right of your screen. The presentation slide deck will also be posted to the Hospice QRP website. The phone lines will be on mute for the duration of the presentations. Due to the large number of attendees on today's webinar, we are unable to field questions over the phone, but you are able to submit questions via the chat function near the bottom left of your screen. If you have a question at any point throughout today's presentations, please enter it into the chat panel. We will answer as many questions as possible during the Q&A session at the conclusion of today's webinar. In the event that time does not allow or if additional research is necessary for some questions, responses to all submitted questions will be posted on the Hospice QRP webpage. We will email attendees when the webinar's Q&As are published. Throughout today's event, we will be using polling questions. Polling questions allow the speakers to ask you questions to gauge your understanding of the material being presented. Each polling question will appear in a separate window in the center of your screen. Review the answer choices offered and choose the answer. There is no need to hit submit. Once you choose your answer, it will automatically be submitted for you. You can change your answer at any time before the poll is closed. Your answers are confidential and will only be reported in aggregate percentages. Now let's test the polling function with our first question. You should now see the polling question window appear in the center of your monitor. The question is, how many people, including yourself, are in the room attending this webinar? Please choose your answer from the choices offered. And I see many responses coming in over the polling. This is wonderful. Thank you all so much for your participation. As you can see, the polling is fairly simple, and we look forward to your participation throughout this webinar. Now for today's agenda. Today's webinar was created specifically to help providers understand the new data submission requirements for the Hospice Quality Reporting Program. We will include a live demonstration to show how to retrieve and use reports that will help you manage the data submission process. We will conclude the event with a question and answer session and finally a wrap-up. At this time, I'd like to introduce today's speakers. Presenting on the Hospice Quality Reporting Program is Jennifer Pettis. Jen is an associate and nurse researcher at Apt Associates. She has more than 25 years' experience in healthcare, including past experience as a clinical and regulatory consultant to the Division of Nursing Homes at CMS. She has extensive clinical, managerial, consulting, and training experience. Jen has provided educational sessions around the country related to a multitude of clinical and leadership issues and has authored or contributed to multiple publications. Jen contributed to CMS's Resident Assessment Instrument User's Manual and participated in the development and delivery of CMS's 2013 and 2014 provider training, as well as the 2014 RAI Coordinator training. Our live demonstration will be led by Julie Ellingson. Julie works at Telegen, the IT contractor that supports the hospice program. Julie Ellingson is a lead solution specialist who has been with Telegen for 20 years and a registered nurse. Julie has had the opportunity to work on multiple federal quality data collection and reporting programs throughout her time at Telegen and has worked with clinical quality measures in various capacities for more than a decade. She is new to the KEYS program since the beginning of the year and is excited to be working with the hospice program. We are very pleased to have such experienced and knowledgeable speakers present on today's webinar, and we really thank them for being here today. It is now my pleasure to turn this session over to Jennifer Pettis. Jen, the floor is yours.
Thank you, Glenna, and thank you all for joining us. The purpose of today's webinar offered by CMS is to prepare you to assist your organization to meet the Hospice Quality Reporting Program, or HQRP, submission requirements. At the conclusion of today's training, we'd like you to be able to articulate CMS's data submission requirements for the HQRP and the consequences of failing to meet the requirements, to describe the Certification and Survey Provider Enhanced Reports, or CASPER Reports, available to hospice providers and how to locate them, and discuss how to interpret Final Validation Reports, or FVRs. Our final two objectives are that you will be able to identify the actions required regarding error messages received in FVRs and locate resources available to support providers with data submission and interpreting the FVRs. We have lots of material to cover today and a great demonstration plan for you, so let's get started. During today's webinar, we're focusing on the Hospice Item Set, or HIS, submission requirements and tools and resources that you can use to help you successfully fulfill the requirements related to the HIS. Section 3004 of the Affordable Care Act authorized the establishment of a quality reporting program for hospices. All Medicare-certified hospice providers must comply with two reporting requirements, the HIS requirements and the Hospice Consumer Assessment of Healthcare Providers and Systems, or CAHPS, reporting requirements. All Medicare-certified hospice providers are required to submit the HIS admission and HIS discharge records on all patient admissions and discharges at their hospice. Hospices must submit the appropriate HIS record for each patient admission and discharge, regardless of the patient's payer source, age, or where the patient receives hospice services. Hospices submit HIS data to CMS through the Quality Improvement and Evaluation System, KEYS, Assessment, Submission, and Processing, ASAP system. On the next slide, I'll define the submission timing requirements. Hospices submit HIS data to CMS through, as stated in the fiscal year 2016 final rule, all HIS records must be successfully accepted by the KEYS ASAP system within 30 calendar days of the event date, patient admission, or discharge. It's important to note that HIS records submitted does not mean that the HIS records are accepted. We'll talk about this shortly. But first, let's look at submission timing requirements a little more closely. The event date for a HIS admission record is the admission date, the date that is documented in A0220. And the event date for a HIS discharge record is the discharge date, the date that is documented in item A0270. For HIS admission records, which will be coded as 1 in A0250, the submission date may be no later than 30 calendar days from the admission date. Therefore, the submission date minus the admission date must be less than or equal to 30 days. For HIS discharge records, which will be coded as 9 in A0250, the submission date may be no later than 30 calendar days from the discharge date. Therefore, the submission date minus the discharge date should be less than or equal to 30 calendar days. It was specified by the Affordable Care Act that hospice providers that fail to comply with the quality data submission requirements will have their market basket update, also known as the annual payment update, or APU, reduced by 2 percentage points. Providers must comply with both reporting requirements to avoid the 2 percentage point APU reduction. The HQRP is currently pay for reporting, meaning it is the act of submitting data that determines compliance with hospice QRP requirements. Performance level is not a consideration when determining compliance and APU reductions. Let's take a minute to understand the sequence of events that occur with HIS data. HIS reporting activities currently operate on a cycle of HIS data collection and submission, compliance determinations, and payment impact that spans 3 years. HQRP reporting years are referenced by the relevant fiscal year for which the provider's APU would be decreased if compliance thresholds are not met. For example, fiscal year, or FY 2018 reporting year, consists of data collection and submission in calendar year 2016, compliance determinations in 2017, and payment impact for the fiscal year 2018 APU. Thus, a provider's APU would be decreased in FY 2018 if they fail to meet HIS submission requirements between January 1st and December 31st, 2016. Just to be clear, when we refer to the reporting period, we are referring to the calendar year, or January 1st through December 31st, during which the HIS admission and discharge records were submitted by the hospice. Reporting year refers to the fiscal year impacted by the HIS records submitted 2 years earlier. CMS will incrementally increase the compliance threshold over a 3-year period. For the fiscal year 2018 APU determination, at least 70% of all required HIS records must be submitted within the 30-day submission deadline to avoid the 2 percentage point reduction in the FY 2018 APU. For the FY 2019 FYU, providers must submit 80% of all required HIS records by the 30-day deadline. Finally, for the FY 2020 APU determination and all subsequent years, providers must submit 90% of all required HIS records according to the 30-day deadline. It's important to define how the HIS submission threshold is calculated. The percent of HIS records submitted on time is equal to the number of HIS records in the numerator divided by the number of HIS records in the denominator, multiplied by 100, rounded to the nearest whole number. If the value in the tenths position after the decimal is equal to or greater than 5, round to the next highest whole number. If the value in the tenths position after the decimal is less than 5, the value preceding the decimal shall be displayed on the report. Let's talk a bit about what records are included in the numerator and denominator. HIS records submitted for patient admissions or discharges occurring during the reporting period, January 1st through December 31st of the year involved, will be included in the denominator of the compliance threshold calculation. The numerator of the compliance threshold calculation would include any records from the denominator that were submitted within the 30-day submission deadline. Let's look at an example. In our example, Hospice Agency A cared for 150 patients during calendar year 2016. Remember, calendar year 2016 is the data collection period for the reporting year of FY 2018. The submission threshold for this is 70%. Because there were 150 patients, there were 300 records, as each patient would have in HIS admission and HIS discharge record, or 2 records each. Of the 300 HIS records Hospice A submitted, 250 were submitted on time. In our example, the numerator is 250 and the denominator is 300. What is the submission compliance rate? The number of HIS records in the numerator is 250, and that's divided by the number of HIS records in the denominator, which is 300. The resulting value is 0.833. This is then multiplied by 100 and rounded to the nearest whole number, resulting in an 83% compliance rate. Now it's your turn for a polling question. Hospice Agency B cared for 100 patients during calendar year 2016. They submitted HIS records for all patients, but only 95 HIS admission records and 80 HIS discharge records were on time. What is the denominator? Is it 100? Is it 200? Is it 175? Or is it 190? And we'll give you just a few seconds here to complete this poll. We do appreciate everybody who's able to participate. It looks like we've got quite a few folks participating. We'll give you maybe 10 seconds or so more to go ahead and get your answers in. And again, thank you for those of you who are able to participate. We appreciate you doing so and taking part in the poll. And Glenna, I think we can go ahead and close the poll. The denominator includes all submitted hospice records. For the hospice agency in this example, we had 100 patients, and all had admission and discharge records submitted. So that's 200 records. So answer B is the correct answer. We had 200 records in our denominator. Great job, and thanks again to those of you who participated. Hospices may request an extension or exemption from required quality data reporting in the event of extraordinary circumstances beyond their control. If an exception or extension is granted, the hospice will not incur payment penalties. Extensions or exemptions will not be made for vendor failures, fatal messages regarding data submission, or staff error. Requests must be made in writing within 30 calendar days of the event that occurred or circumstances affecting data submission, and decisions are made on a case-by-case basis. The Hospice Consumer Assessment of Healthcare Providers and Systems, or CAHPS survey, is the first national hospice experience of care survey. The goals of this survey are to produce comparable data on patients' and caregivers' perspectives of care, create incentives for hospices to improve the quality of care through the public reporting of survey results, and hold hospice providers accountable by informing the public about providers' quality of care. To comply with the fiscal year 2018 requirements, hospices will be required to collect data using the CAHPS Hospice Survey on a monthly basis beginning January 1st, 2016 through December 31st, 2016. Hospices must use a CMS-approved third-party vendor. Data is submitted on a quarterly basis by the vendor. It's important to note that hospices are responsible for making sure the vendor is submitting data in a timely manner. To meet the FY 2019 APU requirements, hospices would collect data January 1st, 2017 through December 31st, 2017. In general, all Medicare-certified hospices must participate in the CAHPS Hospice Survey in order to receive their full APU. However, hospices that are too small or too new are exempted from participation. For example, if your hospice has served fewer than 50 survey-eligible decedents or caregivers during the reference period, you can apply for an exemption from the CAHPS Hospice Survey. Also for 2016, if your hospice received its CMS certification number, or CCN, on or after January 1st, 2016, you are eligible for a one-time exemption for newness. CMS will identify hospices eligible for this exemption. There's no form for the hospices to submit. You can find more information on the website shown on the slide and can contact the CAHPS Hospice Survey Project Team for technical assistance at the email or phone number noted on the slide. At this time, I'm just going to mention a few points about submitting HIS records. Details on these processes are available on the CMS website, including through the September 2015 HIS data submission technical modules that are available. In order to submit records into the KEYS ASAP system, hospice providers need to ensure that an individual who will submit has a CMS Net user ID and password, and that the Juniper communication software is correctly installed on the computer that will be used for submissions. These allow the individual to connect to the CMS private network to access the KEYS ASAP system and CASPER reporting application. In addition to having a CMS Net user ID and password, each individual that will submit must have registered for and activated a KEYS user ID. This ID allows access into the KEYS ASAP system and the CASPER reporting application. Each provider is allowed 2 CMS Net and 2 KEYS user IDs. User IDs and passwords may not be shared. Additionally, the organization must utilize data entry software capable of formatting his records in an XML format and exporting files in accordance with CMS's standard record layout specification. His data submission specifications are available on the CMS website. Finally, before you submit, ensure that the facility ID you received when you registered for your KEYS user ID is correctly entered into the HIS data entry software you choose to use. The Hospice Submission User's Guide is available for download on the Welcome to the CMS KEYS System for Providers webpage. This is the webpage where hospice submissions and CASPER reporting links are available. The User's Guide is also available on the Hospice User's Guide and Training page on the QTSO website. We are not going to detail the whole submission process today. Please be sure to use these resources and review the technical modules that I mentioned to help you further with submission. Later in the webinar, we will provide a quick demonstration of a file submission. Let's spend the rest of our time together, though, answering this question. You've submitted the HIS records. Now what? Once you submit the records, the process is definitely not over. Let's take a look at what happens next. I've said this before, but it's worth mentioning again. HIS records submitted does not mean that HIS records are accepted. That's where the final validation reports, or FVRs, come in. After the submitted hospice data file is successfully received by the KEYS ASAP system, the system validates the file structure and data content. Within 24 hours of a successful submission, generally much sooner, a system-generated FVR is created and made available to the hospice in the CASPER reporting application. This report provides a detailed account of errors found during the validation of records contained in the hospice submission file. The report only displays information about the records where the facility ID could be verified by the ASAP system. Hospice providers must access the FVR to verify the status of the record processing. That is, to identify whether the HIS records contained in the submission file were accepted or rejected, and then review any errors that were encountered. Records that were rejected by the ASAP system are not saved into the KEYS National Repository. Providers must correct the errors that caused the record to be rejected and resubmit the record to the ASAP system. Failure to correct and submit the HIS records may jeopardize the QRP compliance. Shortly, you'll be provided with a demonstration of how to access these reports. But first, let's review the steps to doing so. The Hospice FVR is available to you in the Validation Report, or VR, folder in the CASPER reporting application. A link to access the CASPER reporting application is available on the Welcome to CMS KEYS System for Providers webpage that providers see once logged into the system. Log into the CASPER reporting application using your KEYS user ID and password. This is the same user ID and password used to submit HIS records to the ASAP system, and the VR folder is located on the Folders page. The name of the Validation Report folder is State Code, Hospice, Facility ID, VR. So what does this mean? State code indicates your hospice provider's 2-character state code. Hospice indicates the provider type. Facility ID indicates the CMS-assigned facility ID used for submitting his records, and VR indicates validation report. An example of a VR folder name is NY Hospice 987-654 VR. You'll then select the VR folder name, and a list of ASAP system-generated FVRs displays in the right frame of the web page. Using the information from the initial confirmation page generated after submission of the HIS record file, locate the report link that contains the submission ID of the submitted file. The report names are formatted as submission date and time .submission ID. An example of a file name for a file with a submission ID of 789541 submitted on July 1st, 2015 at 3:30 and 29 seconds in the afternoon is 07012015 153029 .789541. And it's time for you to try one for yourself. A final validation report name 0305-2016-141529 .768904 is referencing a file submitted on what date? Is it May 3rd, 2016? Is it March 5th, 2016? Is it January 1st, 2016? Or are none of these the correct answer? And take just a few moments and answer that question if you would. We have lots of folks chiming in on this one. I appreciate your participation. We're doing great with this. Many folks are answering this question correctly. We'll give you just about 10 more seconds or so. I still see some answers coming in, and then we'll go ahead and close the poll. And based on the answer so far, I think lots of you folks are familiar with how to find these files. That's great, how to identify them. Okay, Glenna, I think we can go ahead and close the poll. And the lion's share of you answered correctly, and that is answer B, and that is March 5th, 2016. So great job, everyone. Once the desired FVR report link is selected, the Hospice FVR displays. The fictitious report on your slide shows the system-generated FVR for submission ID 227291. The report indicates whether the submitted records were accepted or rejected and details the warning and fatal errors encountered. It provides detailed information for each record for which the KEYS ASAP system was able to process from the submission file. The Hospice FVR contains two sections, header and body. The systems in the header section of the report include submission information such as the submission date and time, submitter user ID, submission ID, and processing completion date and time. Provider information such as the FAC ID, provider name, and provider CCN, and processing information such as number of records processed, number of records accepted, number of records rejected, and total number of messages. The information in the body or record section of the report includes record information such as record processing number and record status, patient information such as name, birth date, social security number, gender, and patient ID, and it includes record details such as the target date, type of record, and reason for record. Hospice providers should review the record status for each HIS record reported on the FVR. In the record status If the record status is accepted, this indicates no fatal errors were encountered while processing the data in his record. Accepted records are saved into the Keys National Repository. If the record status is rejected, this indicates that the record encountered one or more fatal errors during processing and the record was not saved into the Keys National Repository. Rejected records must be corrected and resubmitted to the ASAP system. Notice toward the bottom of this report on the slide, it states his items, data submitted, message number, and message. On the next slide, I'll discuss what these mean. The error detail fields display only if errors were encountered during the his record processing. The his items field contains the item or items to which the error message pertained. The data submitted field contains the values submitted in the items listed in the his item field. The message number field contains the unique hospice error message number and identifies the type of message, whether it's fatal or a warning. And the message field displays the text of the error message. Providers should carefully review the FVR to determine the processing status of each record included in the submission file. His records could have one of two statuses. Records with a rejected status contain one or more fatal errors and were not saved into the Keys National Repository. Fatal errors must be corrected and the record must be resubmitted to the Keys ASAP system. Records with an accepted status indicate that the contents of the his record passed all data edits contained in the ASAP system and the record was saved into the Keys National Repository. If only warning messages are returned for a record, the record receives an accepted status and the data are saved into the Keys National Repository. Warnings need to be investigated and may need to be addressed. If a record encounters both a fatal and warning messages, the fatal errors have precedence. The his record is rejected and is not saved into the Keys National Repository. The FVR is automatically deleted from the VR folder after 60 days. CMS highly recommends that hospice providers print or save a copy of the report prior to the system deletion. Should the system-generated report be deleted before it is saved or printed, providers can request the hospice FVR for a desired submission ID or date range in the CASPER reporting application. If a system-generated hospice FVR is not created for a particular submission ID, there was a severe error with the zip file or the files contained within the zip file. To identify the errors that were encountered, request the hospice submitter final validation report, a user-requested report available in the hospice provider report category in the CASPER reporting application. This report provides detailed information about the status of a select submission file. The report indicates whether the records submitted were accepted or rejected and details the warnings and fatal errors encountered. It can only be requested by the user that submitted the file of his records. The report displays information for each record in the submission file for the requested submission ID. If the submission file could not be read, then only one error displays on the report for the entire file. When this occurs, providers should contact the vendor who created the software used to create the file. The vendor must determine why the submission file did not meet the data submission specifications. If you have questions about accessing or interpreting the hospice final validation report, or requesting the hospice submitter report, review the CASPER reporting user's guide, and providers may also contact the QTSO help desk by phone or by email at the contact information on the slide. I've spent the last several minutes discussing the FVRs, or final validation reports. However, It's important to note that there are a number of other reports available in the CASPER system that can be accessed through the KEYS welcome page. His record error detail by provider report details by his ID the errors encountered in his records submitted during a specified period. The his records errors by field by provider report summarizes by error number the errors encountered in submitted his records during a specified period of time. The his records by error number XXXXX report lists for up to 5 specified error numbers the his records submitted for those errors during a specified period of time. The hospice admissions report lists the patients who are admitted during a specified period of time, and the hospice discharges report lists the patients who were discharged during the specified period of time. The hospice error number summary by provider by vendor report summarizes the errors encountered in his records submitted by or on behalf of the provider during a specified period. The hospice item set print report details items submitted for a select his record. The hospice item set submission statistics by provider report summarizes the submissions made by or on behalf of a provider during the specified period of time. The hospice item sets submitted report lists the accepted his records and inactivation requests that were submitted by or on behalf of a provider during a specified period. And the hospice roster report lists the patients of a provider on the day that the report is run. Only patients for whom the most recent accepted his record is not a discharge record are reported. The hospice submitter final validation report discussed earlier is also noted as an additional CASPER report. At this point in the webinar, we'd like to show you the steps of the submission process. We'll turn the presentation over to Julie Ellingston from Telligent at this point.
Great, thank you, Jen. I'm going to share my screen here so that we all can see the demonstration. Okay, today first I'll be demonstrating the steps for submitting your hospice item set or his data to the KEYS ASAP system, and then we'll take a look at the final validation report and a few other reports from the CASPER reporting system related to the validation of the data you submit. As Jen mentioned earlier, prior to being able to submit his data to the KEYS ASAP system, you must first obtain a CMSNet user ID and install the Juniper software on the workstation that will be used for the submission of your his data to the KEYS ASAP system. This allows you access into CMS's private network where the KEYS ASAP system resides. You must also obtain a KEYS user ID and activate it prior to the activation deadline. If you're adding a new staff person to your hospice who will need access to submit his data or run CASPER reports, or you have someone who's left your hospice and should no longer be able to submit his data, you will need to complete and submit a CMSNet Access Request form available on the KEYS Technical Support Office, or QTSO website. Hospices must also obtain his data entry software that's capable of generating his data files in accordance with CMS's standard record layout specifications. The his files must include your hospice facility ID you received after successfully registering for a KEYS user ID. Your files must be zipped with a .zip extension. Your zip file may contain one individual his record or many his records as long as it does not exceed 5 megabytes in size. It's obviously more efficient for you to submit many his records all together in one zip file rather than submitting them individually. Please refer to your software vendor for instructions on creating zip files for submission. I'm going to start at the CMS KEYS Systems for Providers Hospice Welcome page, which we see here. You must log into the CMS network with your CMSNet user ID and password. I won't demonstrate that today, but if you have questions about accessing this network, please contact the QTSO Help Desk. Note all of the links available on this page. In addition to the link to perform hospice submissions, you can access each section of the hospice submission user guide. There's also a link to the CASPER reporting system and access to the CASPER reporting user's manual, as well as links to the KEYS user maintenance application and the KEYS user maintenance application user's guide. You're required to update your KEYS user password every 60 days. If your password is expired, you'll be prompted to change it when you log into either the HIS submission site or the CASPER reporting system, and to be provided with a link that takes you to the KEYS user maintenance application. If your account is locked or you forgot your password, you can also use this application to unlock your account. I'm going to be logging into a test environment today as an Iowa Hospice user, and we'll be using fictitious data for the sake of our demonstration. To submit HIS records, you'll select the Hospice Submissions link, which will take you to the KEYS National System login page. Here you'll enter your Hospice KEYS user ID and password and select the Login button. After selecting the OK button on the Government Authorized Use page, you're taken to the Hospice File Submission page. To upload a submission file, you'll select the Browse button to select the submission.zip file to upload. As mentioned previously, the KEYS ASAP system only processes zipped files with the file extension of .zip. Files with extensions other than .zip will not be accepted. In the Browse box, you'll navigate to the drive on your computer where the submission zip file is stored. Double-click on the name of the file you want to submit. The name of the file is then populated in the File Name field on the submission page, and a pop-up box asks if you want to proceed to upload. We'll select OK. The submission page will display an Upload in Progress message. This may disappear quickly depending on the size of your file. The time it takes the KEYS ASAP system to receive the files you submit depends on the size of your file, as well as other system activity that's also happening at the same time. Until you receive confirmation that the file was successfully uploaded, do not exit the KEYS ASAP system or perform any other function. Doing so could interrupt the file upload process. When the file has been submitted successfully, a pop-up box will display telling you the upload has been completed. Select the OK button to close the box. You'll see that the file submission page then displays an online message confirming your file was received by the KEYS ASAP system. The file submission page also contains an important message letting you know that your submission file will be processed for errors within 24 hours. Once processed, the Final Validation Report, or FVR, which contains detailed information about your submission, can then be accessed in the CASPER reporting application. The confirmation message also contains the submission ID, which is the unique number assigned to your file by the KEYS ASAP system, the submission date, which is the date and time that the KEYS ASAP system received the file in Eastern Time, and the file name, which is the name of the file you submitted. The confirmation message only confirms that your file was successfully received by the KEYS ASAP system. It does not confirm that the file has processed or that the records have been actually accepted by the KEYS ASAP system. Print the confirmation message for your records by selecting the Print link on the right. It is highly recommended that you print this message or otherwise note the submission ID and date information. You will need this information to identify the corresponding system-generated FVR report in the CASPER reporting system. The KEYS ASAP system also allows you to query and view the status of submissions that you performed. To perform a query, you will select the Submission Status option from the menu bar. A box displays showing you the number of records returned by the default search. Select OK in the box, and the list of My Submissions is displayed. This list contains the submission ID, which again is the unique number assigned to the submission by the KEYS ASAP system, the submission date, which is the date and time the KEYS ASAP system received your file in Eastern Time, the submission file name, the total record count, which is the number of HIS records that were contained in the submission file. This value only displays when the records in the submission file have completed processing. We see here that the file I just uploaded is still processing, but a previously uploaded file contains 6 records. The completion date, which is the date and time that the KEYS ASAP system completed validation of your file in Eastern Time, and then the status, which is the current status of the file. The statuses that you may see in this column are waiting, which indicates that the file is waiting to be processed by the KEYS ASAP system, which we see here for the file we just uploaded. Processing, which indicates the submission file is being processed by the KEYS ASAP system. Or completed, which indicates that the submission file processing is complete. It's important to evaluate the total record count value. If the value is greater than 0, then a system-generated hospice final validation report will be available for you in the CASPER reporting system. If the status column displays the completed status and the record count is 0, this indicates that there was a fatal file error, meaning the file could not be read or no records in the zip file could be extracted. When this occurs, no system-generated hospice final validation report will be generated by the KEYS ASAP system. You must contact the vendor who supports your hospice data entry software, as the file is not formatted according to the hospice data submission specifications. To log out, select the Logout button, then select OK to proceed with the logout. This was a quick review of the steps for submitting hospice records to the KEYS ASAP system. We highly recommend you review the Hospice Submission User's Guide, which provides much more detail. Just a reminder that the User's Guide is available through a link on the CMS KEYS Systems for Providers Hospice Welcome page. Next, we'll talk about the CASPER reporting system. There are several reports available for hospice providers in the CASPER reporting system. You have access to a couple of different kinds of reports. First are the auto-generated reports, such as the Hospice Final Validation Report, that are automatically created and placed in a folder specific to your hospice. The other kind of reports are user-generated reports, which can be requested on demand at any time. For this demonstration, we will focus on the Final Validation Report, as well as a few of the user-generated reports. To access the CASPER reporting system, select the CASPER reporting link on the CMS Hospice Welcome page. This takes you to the KEYS National System login page. Enter your hospice KEYS user ID and password and select the login button. After selecting the OK button in the Government Authorized Use page, you're taken to the CASPER Topics page, which is the CASPER Reporting System home page. This page contains links to all of the functionality available in CASPER. I'm logged into a test environment for our demonstration today, and all of the patient data that you'll see in our reports is fictitious. First, we'll talk about the Final Validation Report. As I just mentioned, after a hospice submission file is successfully received by the KEYS ASAP system, the system validates the file structure and content, and within 24 hours of a successful submission, a system-generated final validation report is produced for you. This report contains detailed information about your submission. To retrieve the system-generated final validation report, select the Folders button from the menu bar. On the left side of the page, you will see a folder that is specific to your hospice. The auto-generated final validation reports are placed in this folder. The name of the folder contains your hospice's 2-character state code, the letters HOSPC for hospice, your CMS-assigned facility ID, used for submitting the hospice records, and the letters VR for validation report. I am logged in as an Iowa hospice user, and here we see my hospice's folder. This VR folder may be viewed by you and others with KEYS user IDs who can submit files to the KEYS ASAP system for your provider. Hospice users only see a folder for their provider and not any other providers. Select the VR folder to view the system-generated final validation reports. As mentioned earlier, the report names are formatted as submission date and time .submission ID. For example, we see here the final validation report for the file I submitted just a few minutes ago. So it has today's date and time I submitted it, followed by the assigned submission ID. Note that there are two reports created for each submission, a text output report and an XML report. You will want to view the text output report, which is much easier to read. The XML report is only created for software vendors. To open and view a report, select the report file name that contains the submission ID from the confirmation message that displayed when you submitted your file to the KEYS ASAP system. Again, the submission ID is the value after the period in the report name. So let's select the file for the submission we just completed. The FVR report provides details on whether the records submitted were accepted or rejected and details the warning and fatal errors that were encountered during processing. Detailed information is provided for each record the KEYS ASAP system was able to process from the submission file. The beginning of the report shows you the number of records processed, the number accepted, number rejected, number of duplicate records, and the number of records submitted without provider authority, meaning they were submitted by a user who did not have the authority to submit records for your hospice. This report should be viewed carefully to determine the status of the processing of each record. In my validation report, we see details for each of the files I submitted. We see here that record 1 was accepted with a 3034A warning error. This warning message is triggered when the hospice admission record is submitted greater than 30 days following the admission date. Record 2 was also accepted with a 3034B warning message. This warning is triggered when the hospice discharge record is submitted greater than 30 days following the discharge date. Record 3 was accepted with a 915 warning message. This warning is triggered when there is a difference in patient data from what has been submitted in the KEYS ASAP system previously, such as a name spelling or a different birth date. The patient information was similar enough to what was previously submitted so that a patient match was identified. As long as the record was accepted, one or more fields were updated with the new or previously missing information. Record 4 was accepted with no error messages, as well as record 5. And record 6 we see was rejected with a 903 fatal error. This happens when one of the HIS items is left out of the file or the data in the item is present but contains invalid data. This is an error caused by your vendor. You will need to contact your vendor to fix the software. Note that records with fatal errors are not saved in the KEYS ASAP system. Corrections should be made to the records with fatal errors, and they should be resubmitted within 30 days following the target date to assure that they are submitted timely. The final validation report is automatically deleted from the VR folder after 60 days. Therefore, CMS recommends that you print or save a copy for your records prior to the deletion. We'll select the back button in our browser to go back to the CASPER reporting system. Next, we'll talk about some of the CASPER user-generated reports. To run your own on-demand report, select the Reports button in the menu bar. All of the available hospice provider reports are listed on the right. For this demonstration, we'll cover just a few of these reports that are specifically related to file submission and validation. I pre-ran most of the reports for us to save time for the sake of the demonstration, but we'll run the first report together. First, we'll run the user-generated hospice final validation report. This report is basically the same as the auto-generated hospice final validation report that's placed in your hospice's folder following a submission. The records included in the report are identical to those in the auto-generated report. They just may be in a different order. To run any of these user-generated reports, you'll click on the name of the report to access the CASPER Reports Submit page for the report. submit criteria for this particular report includes either the submission ID or date criteria. If you enter date criteria, the report will contain data for all of your hospice's submissions made during that time frame. Once you've entered your desired criteria, select the Submit button. If there are any issues with the criteria you entered, you'll see a validation error. If there are no validation errors, you'll see a message that the report is being queued and that completed reports will appear in your inbox on the Folders page. You can click on the Queue button to see where your report is in the queue. Clicking refresh on this page will update this page. Here we now see that we have no reports in the queue, so our report must be ready for viewing. Once you've selected and run any of the hospice provider reports, the report output will be available for you in the My Inbox section on the Folders page. So we'll select the Folders button, and then we'll select My Inbox. Here we see the report I just ran from my hospice. Click on the report name to access the report. And here we see our user-generated final validation report. To go back to the CASPER reporting system, once you've finished reviewing a report, click the back button in your browser. I'm going to click the Reports button here to go back to the reports list. The Hospice Submitter Final Validation Report is just like the Hospice Final Validation Report we just looked at for just the submission ID you enter at the time you request the report. Note that this report can only be requested by the user who actually submitted the file. The Hospice Roster Report lists all of the patients on record for your hospice for whom the most recent accepted HIS record is not a discharge record. In other words, all active patients. There are no specific retrieval criteria to enter for this report. Earlier, I ran this report from my hospice and saved it off to my computer. This report shows me for each patient the patient ID, name, social security number, date of birth, gender, admission date, and admission record submission date. You can use this report to verify that all of your current patients have had their appropriate HIS admission record accepted and that all discharge patients no longer display on this report to verify that their discharge record has also been submitted. There are a few reports that may help you further analyze and pinpoint errors that your hospice may be seeing with your submissions. I'll go back to my inbox on the Folders page to look at the reports I ran previously. First, let's look at the Hospice Item Set Submission Statistics by Provider Report. This provides you a summary of your submissions during a specified time frame. Retrieval criteria include just your date criteria. For an example, I ran this report for my hospice to see my quarter-to-date submission statistics. This report shows by each submission ID the number of records processed, number rejected, and number accepted, as well as the percent rejected during the specified time frame. Totals are provided at the bottom of the report. This report could help you easily identify submissions that contained rejections so that you can research further if needed. Although you should be regularly reviewing your final validation reports following each of your submissions, this is another great source to look for submissions with rejected records if needed. Next, we'll look at the HIS record errors by field by provider report. This provides you the count and percent of HIS records by error number and field that encountered the error number during a specified time frame. The retrieval criteria for this report include date criteria and message type, whether fatal, warning, or both. For an example, I ran this report for my hospice for the prior calendar week for both fatal and warning messages. Looking at the report, we can see the total HIS records submitted during the week, each error number that was encountered, the error message, the HIS item or items from which the error was triggered, the number of HIS records that had this error, and the percent of HIS records submitted that had this error during this time frame. Next to look at is the hospice error number summary by provider by vendor report. This report summarizes the errors encountered on HIS records that were submitted for the hospice during a specified time frame. It shows you by error number the number of times the error was encountered and the percent of HIS records with the error. The retrieval criteria for this report include just your date criteria. For our example today, I ran this report for my hospice for the current quarter to date. Looking at the report, I see that my hospice had a high percentage of error 3034A, indicating that many of my hospice's HIS records were submitted late. This is an example of how this report can help you stay alert to issues you may be having with your submission timeliness. As Jen reviewed earlier, you want to make sure you're meeting the required submission timeliness threshold to avoid that 2% reduction in your market basket update. The last report we'll look at is the HIS records with error number XXXXX report. This provides you, for up to 5 specified error numbers, a list of HIS records that were submitted with the selected error numbers during a specified time frame. The retrieval criteria for this report include your date criteria and the selection of up to 5 error numbers. This report helps you identify the records where specific errors were encountered during submission so that you can remedy an error and resubmit if needed, or perhaps look for trends for when errors are occurring. For an example, we found out in the last report we looked at that my hospice had a high percentage of records submitted late this quarter. So I decided I wanted to see the details of those records to maybe look for a trend of why they were submitted late. So I ran this report for the current quarter to date for the error number 3034A. This provided me with a report of the HIS records that encountered this late submission error. By looking at this report, I may be able to determine, for example, that most of the late records should have been submitted during late March to early April, which is when my main staff person who submits the HIS records was on vacation. This may indicate to me that I need to implement enhanced staffing coverage for submissions, or maybe update my procedural guidelines or post them more clearly to avoid any further issues with late submissions under these circumstances. So that concludes our quick review of a few of the hospice provider reports available in CASPER. All of the CASPER reports are detailed in the CASPER Reporting User's Guide, available on the Keys to Success website or through the CMS Keys Systems for Hospice Providers login page. You may also review recorded training sessions available on the QTSO eUniversity website. From the QTSO homepage, select Online Training in the left navigation menu. Then select Hospice and click Go. You do not need to enter a username and password here. Recordings and handouts are provided for CMS.net user ID registration process, installing the Juniper software, Keys user ID registration process, an introduction to the Keys ASAP and CASPER reporting systems, the hospice item set file submission process, retrieving and interpreting the hospice final validation report, and then other CASPER reports for hospices. At this time, I'll turn it back over to Jen, who will go into some more detail regarding the validation of records.
Thank you very much, Julie. That was very helpful. The KEYS ASAP system validation edits are designed to monitor the timeliness and ensure that the submitted records conform to the HIS data submission specifications. If submitted HIS records do not meet the edit requirements, the system will provide fatal error and/or warning messages on the FVR. We'll review 3 overarching processes involved in the validation of records and files, including the initial submission confirmation, validating and editing, and storage to the KEYS ASAP system. Let's talk about each of these a bit. The first process is the initial submission confirmation. For each file submitted, the submitter will receive an online confirmation that the file was received for processing and editing by the KEYS ASAP system. This confirmation information includes the file submission number, as well as the date and time the file was received for processing. Providers should print and maintain a copy of this information. Next, let's look at validation and editing. Each time a user submits a HIS file to the KEYS ASAP system, 3 types of validation are performed. First, the file structure is validated to ensure it follows the requirements outlined in the HIS data submission specifications provided by CMS. If it does not, a fatal file error is received and the file is rejected by the KEYS ASAP system. Examples of fatal file errors include that the file is not a zip file, that the records in the zip file cannot be extracted, or the file cannot be read. The submitter final validation report will list any fatal file errors. Files that are rejected must be corrected and resubmitted. If the file structure is acceptable, then each HIS record in the file is validated individually for fatal record errors. These errors include, but are not limited to, out-of-range responses. For example, if the valid responses for an item were 1, 2, and 3, and the submitted value was 6. Or inconsistent relationship between items, for example, an inconsistent date pattern, such as the patient's birth date as documented in item A0900 is later than the admission date as documented in item A0220. Fatal record errors result in rejection of individual records by the KEYS ASAP system. The provider is informed of fatal record errors on the FVR. Rejected records must be corrected and resubmitted. The record is also validated for warnings or non-fatal errors, and warnings include but are not limited to missing or questionable data of non-critical nature or item consistency errors of a non-critical nature. Examples of warnings include timing errors. For instance, the submission date is more than 30 days after the admission date as documented in A0220 when A0250 equals 1. Or the completion date, as documented in Z0500B, is more than 14 days after the admission date in A0220 when A0250 equals 1. Or there could be record sequencing errors. For instance, a HIS admission record is submitted after a previous HIS admission record when there was no HIS discharge record submitted in between. Or a record is submitted for a patient after a HIS discharge record with a reason for discharge equal to expired. All warnings or non-fatal errors are reported to providers on the FVR, and the provider must evaluate each warning to identify necessary corrective actions. Finally, records are stored to the KEYS ASAP system. If there are any fatal record errors, the record will be rejected and not stored in the KEYS ASAP system. If there are no fatal record errors, the record is stored in the KEYS ASAP system even if the record has 1 or more warnings or non-fatal errors. Remember, providers must evaluate warnings and take necessary corrective actions. These warnings will appear on your FVRs and must be evaluated and, if necessary, addressed. If a HIS record is found to have errors that incorrectly reflect the patient's information within the respective record period as established by CMS, then that record must be corrected. The correction process will depend on the type of error. HIS records that have not yet been accepted into the KEYS ASAP system include records that have been submitted and rejected, or records that have not been submitted at all. Records that have been submitted and rejected can usually be corrected and resubmitted without any special correction procedures because they were never accepted by the KEYS ASAP system. Hospice are responsible for correcting any errors to the record prior to submission or resubmission of the record to the KEYS ASAP system. An error identified in an accepted HIS record must also be corrected and can be corrected even if subsequent records have been accepted for the patient. Two processes exist for correcting HIS records that have been accepted into the KEYS ASAP system. A modification request when A0050 equals 2, or an inactivation request when A0050 equals 3. Completion of a modification request record will archive the inaccurate HIS record within the KEYS ASAP system and replace the record with a new corrected record. Completion of an inactivation request will also archive an inaccurate HIS record within the KEYS ASAP system, but will not replace the record with a new record. Hospices should retain a copy of the HIS along with any corrected versions to track what was modified. In addition, it's suggested that the hospice keep a copy of inactivated records, and they can do so electronically. A modification request record, as reflected by coding A0050 as 2, is used when a HIS record is accepted into the KEYS ASAP system, but the information in the record contains clinical or non-key demographic errors. The modification request record is used to correct HIS record items that are erroneous. However, there are items that cannot be corrected with a modification. Rather, the invalid record must be inactivated with an inactivation request record or manually deleted and a new record submitted to the KEYS ASAP system. Items that cannot be corrected with a modification request are record event identifiers and patient identifiers, and I'll share a list of these specific items with you shortly. To make record event identifier and or patient identifier corrections, you must complete an inactivation request record for the incorrect record and create a new record with correct information, and we'll talk about that shortly as well. When a modification request record, as indicated by A0050 equals 2, is submitted, the KEYS ASAP system will attempt to locate the existing record in the database for the hospice using specific identifiers. If the existing record is found, then the system performs a series of validation edits to evaluate whether the data submitted meets the required data specifications. If there are any fatal errors, the modification request record will be rejected and not accepted in the KEYS ASAP system. The fatal error or errors will be reported to the hospice on the FVR. If the modification request record passes all the edits, it will replace the prior erroneous record in the KEYS ASAP database. The prior erroneous record will be stored in an archive file within the database. If the existing record is not found, the submitted modification request record will be rejected and not accepted into the KEYS ASAP system. A fatal error will be reported to the hospice on the FVR. An inactivation request record indicated by code 3 in A0050 must be used when a record has been accepted into the KEYS ASAP system, but the corresponding event did not occur. For example, a HIS discharge record was submitted for a patient, but there was no actual discharge. And when one or more of the event identifiers or patient identifiers is found to be in error. And here's that list of issues that can't be modified that I mentioned to you. An inactivation request must be completed when any of the items listed on this slide are inaccurate. These items cannot be modified. Record event identifiers include the admission date, the reason for record, and the discharge date. And patient identifiers include the first name, the last name, social security numbers, gender, and birth date. Values on the inactivation request record must match the erroneous record. The provider must then complete a new HIS record with the correct event or patient identifiers. When an inactivation request is submitted, the KEYS system will attempt to locate the existing record in the database using specific identifiers: patient last name, first name, social security number, birth date, gender, facility identifier, the facility and state code, event identifiers including the reason for record and admission, and discharge dates. If the existing record is not found, the inactivation request record will be rejected and a fatal error will be reported on the FVR. If the existing record is found, the erroneous record will be removed from the active records and stored in an archive file within the database. A special manual record deletion request is only necessary when there has been an error in a record that has been accepted into the KEYS ASAP system that cannot be corrected with a modification or inactivation request. There are only two items to which this applies. A manual record deletion request must be performed when the record has the wrong state code or wrong facility ID in the control items. Control items are created by the HIS software. These errors most likely occurred at the time of software installation when initializing the software and not during routine entry of patients' administrative or clinical data. In the event that this error has occurred, the provider must contact the QTSO Help Desk to obtain the manual hospice item set record correction form. And it's time to check your understanding with a question for you. While reviewing a patient's HIS admission record prior to submission, you note that A0220 admission date is incorrect. What is the correct action to take? Do you modify the assessment and resubmit it? Do you inactivate the assessment and submit a new record? Or do you correct the item and submit the record? So you have three options there. Do you modify the assessment and resubmit it? Do you inactivate it and submit a new record, or do you correct the item and submit the record? And we'll give you just a few more seconds. We've got lots of folks making a guess there at the polling question, so that's great. Thank you. Okay, I think we can go ahead and close the poll. Thanks for those of you who did submit a response. In this example, the record has not yet been submitted. You can simply correct the error and submit the record as it has not been submitted once. If the record had been submitted, you would need to inactivate this item. Great job. And I have one more question for you to consider. While completing a HIS discharge, you note that J0900D, type of standardized pane tool, was erroneously coded as 2 rather than 1 on the HIS admission record that was submitted 2 months ago. What is the correct action to take? Should no action be taken, corrections must be made within 30 days? Should you modify the HIS admission record or inactivate the HIS admission record? And again, we'll give you just a few moments here to answer that question. And once again, thanks to everyone who's participating. I see lots of you clicking in with your answers. That's great. You can I'll give you a few more moments to go ahead and submit a response. I think we can give it just a few more seconds. We still have answers coming in. Okay, I think we can go ahead and close that poll. And the correct answer is B. We would modify the assessment. Hospices should correct any errors necessary to ensure that the information in the KEYS ASAP system accurately reflects the patient's hospice record. His record may be corrected even if subsequent records have been accepted for the patient. So to wrap up, today we've reviewed CMS's data submission requirements for the HQRP and the consequences of failing to meet those requirements. You've learned about the CASPER reports available to hospice providers and how to locate them, as well as how to interpret the FVRs. The actions required regarding error message received in FVRs were reviewed, and you've been told about resources available to help you successfully meet his submission requirements. Additional resources are listed on the last slide of this program. I'd like to offer a sincere thank you to Julie Ellingston from Telegen for providing us with the demonstration, and I hope you found this program helpful. We'll now take questions from our audience, and Glenna, I'll turn it back over to you.
Thank you so much, Jen. We will now be taking questions over in the chat box, and we thank you all for submitting questions so far. Our first question, Bridget, do you mind if you let us know what the first question is?
Yes, the first question is for Jen. And Jen, the question is, what is the target date? Jen, can you hear me?
Yes, I can. Sorry about that. The target date is documented in the Hospice Item Set-Based Quality Measures for the Hospice Quality Reporting Program User's Manual. And the target date for a record is defined as follows. For an admission record, when A0250 reason for assessment equals 1, the target date is equal to the admission date, so the date documented in A0220, and that's the admission target date. And for a discharge record in A0250 reason for assessment equals 09, the target date is equal to the discharge date in A0270, and that's the discharge target date. And again, this information is available in the Hospice Item Set-Based Quality Measures for the Hospice Reporting Program User's Manual, version 1.00.
Thank you very much, Jen. I think the next question is for Deb. Deb Weiland, would you please answer a question that was submitted? The question is, I use the submitter final validation report instead of the FVR. Is that acceptable?
Thank you, Bridget. That's a great question. It is acceptable to request and review the submitter final validation report. This report provides the same detailed information as the ASAP system-generated final validation report. A special feature of this submitter report is that it will also include any records that could not be processed due to a severe error by the ASAP system. If there was a record with a severe error, that record will not be displayed on the system-generated final validation report because the ASAP system would not be able to identify to which hospice that record belonged. There are a couple of tips I'd like you to remember about the submitter final validation report and the ASAP system final validation report. A benefit to the ASAP system-generated report is that it is automatically created for your hospice if the records in the file could be read by the ASAP system. So accessing the system-generated report saves you from having to request the submitter report yourself. However, if you would like to use the submitter final validation report, that is acceptable. But remember that the user that requests the submitter final validation report must be the same person or user ID that submitted the file to the ASAP system.
Thank you very much, Deb. The next question that came in also is a question for Deb. Deb, can you explain what a 915 or a 915 error is?
Sure, I'd be glad to talk about that error. The 915 error is a fairly common error, and this is a warning message. It does not cause your HIS records to be rejected by the ASAP system. It is a message that merely indicates to you that one or more pieces of patient identifying information from the HIS record did not match the current patient information that we have for that patient in the national database. So if the accepted HIS record contains a different patient identifying information than what is in the database, and the HIS record is accepted by the ASAP system, that particular piece of patient identifying information is updated in our national database. And there are certain fields that can, or patient identifying fields that can cause this error to occur. And those fields include the last name, the patient's first name, middle initial, birth date, death date, Social Security number, Medicare number, Medicaid number, gender, or race ethnicity items. For example, if you have a patient that has died in your hospice, you would be submitting a death date in the HIS record. The death date in the HIS record would be updated for that patient in the national database, because obviously there wouldn't have been a death date prior to that patient's death. When the information is updated in the national database, the error 915 warning message is returned on your final validation report. And it serves mostly to be informational to you. It's a notification letting you know the patient identifying information that has changed, and allows you the opportunity to ensure that that update that was made in the national database is accurate. If after reviewing the final validation report you find that that update was inaccurate, then you must act swiftly to correct that erroneous information. And I'd like to also point out a couple of other tips about the 915 error. The 915 error will also occur if you're submitting a record for a patient who was previously cared for by a different provider. So that error could happen often because of a change in provider. And it's also important to know, and most have probably noticed this, when you receive error 915 on the validation report, the old and new patient identifying information is displayed on the report. For example, if the patient's first name was Joe and the HIS record that was just processed by the ASAP system contained a first name of Joseph and the national database was updated, then those two values will display on the validation report. And again, it is your responsibility to verify that the updated information is accurate.
Great, thank you very much. The next question is for Jen. And Jen, if you could answer the question, if an admission occurs in one calendar year and the discharge in the following calendar year, how is the calculation adjusted?
Sure. It would be helpful if that caller or that questioner would submit their question to the CMS Hospice Quality Questions website, which is hospicequalityquestions@cms.hhs.gov. And the folks at CMS will work in collaboration with the measure developers who have the expertise to answer that question.
Great. Thank you very much, Jen. The next question goes to Deb. And Deb, how long are our submission records kept on the CASPER site? was the question from the participant.
That's another great question, Bridget. Accepted HIS records submitted to the ASAP system are kept in the national database indefinitely at this time.
Okay, and it looks like thank you very much, Deb, and it looks like we are out of time, so I'm going to turn the call back over to Glenna to wrap up for us. Thank you very much for answering the questions, Jen and Deb.
Thank you so much, Bridget. Thank you so much, Jen. Thank you so much, Julie, for presenting on today's webinar. This concludes today's Hospice Quality Reporting Program follow-up webinar for providers. Please note that you will be receiving an evaluation that will open up at the conclusion of our event so that you can provide us with your feedback regarding today's session. You will also receive a reminder by email to complete the evaluation if you are unable to complete the evaluation at this time. Thank you all so very much for attending our webinar today, and we want you to enjoy the rest of your day. Thank you so much. Bye-bye.
This concludes today's webinar. Thank you for attending.